All right, it should be live now. Hello, everyone, and welcome. I am MJ, and this is All Things Crunchy, another episode. We are live tonight on YouTube only. YouTube is now, there's no more Google, so it doesn't really mean anything probably to you out there, but it does to me and everything that I had to do to get the show on tonight. So with that, if you are watching us live, thank you, first of all. And second of all, if you have any comments or questions, just go ahead under the video and leave them right there. And they should load up to my phone, which I have right here. And hopefully I can read your comments or we can answer your questions during the show. And then afterwards, if you put them, please do after the show, if you watch later, leave your comments or questions. I'd love to get them answered for you. So let's get into our show tonight. And before we start talking about our topic, which is surviving new motherhood, I'm going to introduce my guest tonight. So I am so thankful to have my guest expert tonight is Dr. Jenny Thomas. Hi, Dr. Jen.
Hey.
You are not only a pediatrician. We were talking a little bit about before the show all the acronyms behind your name there. But the one thing that I really want to point out to our viewers here, and we do have somebody watching us live, and it might be my best friend and her daughter. So thank you. But one of the things I want to point out is that you're not only a pediatrician, but you are pro breastfeeding. You are an international board certified lactation consultant, which if my viewers, if you don't know, and if you do know, you know that most pediatricians don't have to be educated in breastfeeding. So that's huge. So thank you.
They should be educated in breastfeeding, but they don't all have to be IBCLCs. So that was a conscious decision on my part. Very happy with it. Very happy I did so.
I know it, and just from a mother standpoint, I mean it's huge, you know, just wanting to have somebody that supports you breastfeeding, and it's amazing how many pediatricians out there are quick to give other options, I guess, very quick to give other options. So I'm really excited that I get to have you on tonight, and thank you so much for taking the time out. I know we're in different time zones here tonight, and you're a doctor, so I'm sure that you might be on call or something too. So
no, not tonight. I'm okay.
Good.
Pager's off.
Well, I know you're busy, so let's get going on the topic a little bit here. So surviving new motherhood, and I love it that we're doing it from a pediatrician's perspective, because I this is the way that I think it should be. You know, we, as most of us new mothers, we go into motherhood, and we do need a pediatrician to support us. And so, you know, of course, we're looking for all sorts of support. So we're going to talk about a few different things. And let me start out. One of the first things that we're going to talk about here is the feeding of your baby. And so, you know, there's like we had talked about in the subject of the show, there's lots of tracks. There's, you know, this 21st century, there's so many expectations from, my God, you get the people on the corner that want to give you advice. You know, you've got your family, you've got your friends, you've got so many things. And then there's lots of misinformation out there. So, you know, on all these three subjects that we're going to talk about here are the subtopics. We'll go into kind of those things. So I'm going to hand it over to you. I know that obviously you deal a lot with breastfeeding and all of the traps that can go into that. So I'll kind of let you start talking about that one. And
it's incredibly difficult to be successful at breastfeeding, especially in the United States, and we have so much work to do. There are people, a growing amount of people who are delivering at home, but the hospital practices are the places that have the most impact on how a new mother experiences breastfeeding for the first time. And we're really trying to work with hospitals all across the country to make sure that their practices are evidence-based and that they're not designed to sabotage breastfeeding right from the word go. And that's one of the harder parts about doing breastfeeding medicine, is that I listen to a lot of stories where I feel that we have a lot of opportunities for improvement. One of those is there's I call them my 3 B's that get in the way of starting off breastfeeding, and one of them is birth weight. Most babies wind up born waterlogged because of the IVs that most moms get when they go into the hospital. So there's inevitably some weight loss, and I think there's a tendency to just supplement at a certain number without really taking a look at the context. We also get a little worried about bilirubin and blood sugars, and that's sort of on my profession. We need to do a better job of taking a look at the whole clinical context. But it's also in the hospital that I get some of the biggest rush that I get in medicine, which is watching babies latch, watching and helping moms through those first several hours, giving them just help to, like, even so now that I've been doing this for a long enough period of time, I think I've been doing this for about 16 years, and I used to be all like getting in there and messing with the mom and the baby, and now like it's so much nicer to have the mom lay back all the work. I love that. I love it. And if people want to look at that, it's called the baby crawl or baby led latch. It's so beautiful. It's the most amazing things. So
I think
we have plenty of opportunity. Oh, I do it every single time I go into a room. It is so great to let the family see all of the wonderful things that that baby can do all by themselves. You know, like, there's a theme sort of in when I am talking to the people in my practice where I'm like, we're really essentially mammals. We're mammals who need security and love, and we have a baby that can't yell for help or run away. And so the normal feeding behavior might be confusing to somebody who is expecting 15 minutes on a side every 2 to 3 hours, which is, you know, 15 minutes on a side. We have a lot of need for charting. You know, we got to have this written down and that written down, and there is no correlation between how long a baby stays at the breast and how well that feeding went. And I think asking people to write down, hey, how long did that take? That there is some type of correlation. It's not a meaningful record.
Yeah, and that can kind of make you crazy a little bit as a mom.
Yeah, let's just throw numbers. Let's throw numbers everywhere. The recommendation is for a kid to go to the breast, a new baby to go to the breast 8 to 12 times in a 24-hour period. And that, like, people show off, they do math. Not particularly good at it myself, but, you know, 8 to 12 times in a 24-hour period is not every 2 to 3 hours. And I think right from the word go, then we start setting up an unrealistic expectation that you're going to get a break in between feedings, because sometimes you don't, and the next feeding might be 45 minutes later, and the baby never wants to be put down because baby knows where the baby's got it good, you know. And so there's just a lot of mixed messages associated with numbers in those first couple of days that are frustrating to me. So I go in and I say, this is what's going to happen. Your baby's going to lose weight. We are going to see them turn yellow because we are the only species that turns yellow. Species that picked to get jaundiced. And the best way to make sure that all of this goes well and that nobody worries is to make sure that they're nursing well, and just trying to set them up for really realistic expectations. Like, the animals that hunt us hunt at night. So your baby's going to be up at night because that's cool. That's how they stay alive.
And
their food.
right. And then also too, I actually had, and I mean, I read this, I'm assuming that it's true. I had low milk supply with my son, but we nursed all night long. And I learned later on that that's when your milk is most plentiful. So I was like, well, he's very smart.
It's the nighttime milk tends to have the most fat content.
Oh, okay.
And has enough calories in it. It's fat is supposed to help you sleep. That doesn't necessarily mean that newborns are going to sleep. But the milk that you make first thing in the morning is more thirst quenching, and the stuff that you make at night has a little bit more fat content in it, which is supposed to facilitate sleep. So.
Gotcha. Okay.
But it's worth trying. Everybody who has a baby, it's worth trying breastfeeding. And most of the time when people don't meet their goals, it's some failure of the system to support you adequately. And that's tough. That's tough. Like this week for me has been a big medications and breastfeeding week. Where I have heard a lot of women who've had to pump and discard their milk or have decided to flat out wean because they need a medication. And that's very frustrating.
Yes. So. And usually that is like right when they're, we're asking the questions like, okay, I'm going to get this medication, or I'm going to have to get a test, or I'm at the dentist, and then we get this horrible information right there from, whoever is in front of us. And then we don't have the time to really, figure it out. And I think that really sabotages us too, is not getting ready to know. And sometimes, of course, if something is an emergency and we need to kind of, do it that way, then maybe we don't know. But gosh, it would be nice if you had somebody, there to say, like you, come in and say, no, you don't have to. You can keep nursing.
I usually ask my patients to tell me before they ever pump and discard anything. Like, please don't let that happen. I also really recommend that people download the app for LactMed, so that you have it right on your phone, and that if you have somebody that doesn't necessarily agree with you or is saying that you need to pump and discard your milk, that you can just be like, here, read that. And so
that is a great app, and I'll put that in the comments under the show. And I think that what you were talking about earlier too is it's called like the UCEF birth crawl, right? Is that what the?
Yeah, there's one there's a baby crawl, but man, just a search here on YouTube is not. Will not be disappointing. So if you watch the baby crawl, it's quite beautiful. And I think if you're nervous about feeding your baby and you watch your baby go and wiggle and move and land on the nipple, and you go, what? That was great. Like, okay, you know what you're doing. I just have to make sure that you get there. Yeah, it's really empowering, and I think it's a really good way to hold the baby in the first couple of weeks, especially. So
yeah, and laid back breastfeeding too, just like you said. I mean, that's actually something that's really helpful for women that have like oversupply, and just it's a way of breastfeeding for a lot of people that is probably helps a lot of issues. So
it's very easy to teach in the hospital, and I'm hoping we just get more and more people to do that, so that they can see the innate skill set that the baby is born with. Like, we didn't have a lactation pop out right after your placenta. There's nobody saying, here, baby, that doesn't happen with any other species. It doesn't happen with us. So watching the baby crawl and latch is something that should, I hope, give people a lot of confidence that, you know, like, wow, you don't have to sit up straight. You don't have to have a lot of pillows. You don't have to get the baby positioned correctly. Once, let them go.
Exactly.
Yeah.
That is a lot of things in parenting that I've found now that I have an almost 5.5-year-old. They really are smart. They're smart
Sometimes, yeah.
from
Sometimes they're
newborn.
fantastically smart. Other times you're just like, what? So, what are you doing?
There we
Where is your sense of self-preservation? Where did that go?
go. There you go.
Why are you on my bookshelf?
Yes, I know, and that difference between safe and fun. Yeah.
That line, that
So,
tiny little
yeah,
line.
exactly. I know. One of the I'm gonna switch over to baby sleep if that's okay with you.
Yeah, it's fine. Hmm.
Um, so one of the when I was first a first newborn mother myself, I came across this article that you wrote about normal baby sleep, and I mean it just really I can't even I'm actually stoked that I'm able to tell you in person because it just gave me like I was like okay, my son did not
That's so great
sleep.
to hear. Like, I
Yeah.
write this stuff. I don't know if anybody ever reads it. That's fine.
Oh my gosh. And I shared that, seriously, Dr. Jen, I shared that every time somebody would, these Facebook groups that I would be in with moms. It was just my go-to because it was like, it just like helped my world come back to, okay. I was like trying to figure out, all this that was going on and then also missing sleep and then trying to figure all that out. And I was like, I didn't understand what I was doing wrong because my son was just he was not a sleeper. He would sleep like an hour, maybe two, but he would always wake up and he did that until about two. So it was a long time,
I
but
usually tell people 18 months. It's about 18 months. Like, by the time that your kids can talk and run, it's, now you have a skill set that can save you that, and you don't have to go run to your parents. But our ability to sleep has a lot to do with how safe we feel in our environment. And every sleep cycle ends with an awakening before we go into the next sleep cycle. So we have several sleep cycles over the course of an evening, and each sleep cycle is progressively shorter, and each sleep cycle has progressively more dream sleep. So you start in a very, very deep level of sleep, and then you move towards the morning in a very in dream sleep, and you can get pretty easily out of dream sleep. But that restorative, really deep sleep is that part of sleep is characterized by no sensory information. You can't get anything to you. And so I've had families tell me that they took one of their kids, put him in the shower to try to wake him up so that he wouldn't wet the bed. And the shower couldn't wake him up. And I have this picture of this bladder in my head going, hello, I'm full. So it really, there's so little sensory information. That means when you fall asleep for that next sleep cycle, you are headed into a time where you can't receive any cues from your environment. You need to know that your environment is safe in order to go back to sleep. And for a baby, that basically means you better be around. So until it's so hard because there's almost a moral sounding judgment to sleep, where if you have a good baby, if you have a good sleeper,
right,
you're a good parent, and your baby's wonderful. But if your baby doesn't sleep, your baby is defective and you stink as a parent. So that's pretty, and that's one of the very first questions that people ever ask you is she a good sleeper? And you just want to go, no, she's a baby.
Yes.
So
That actually was
very
what,
frustrating.
yeah, that's what drew me to the article was I think the topic was, does your baby sleep through the night? And that was just I mean, I got that question at 1 week, 2 weeks old for my son, and I'm just like, I'm sitting there
He's
going,
supposed to?
yeah,
Is he supposed to?
uh,
He didn't read the book. He didn't read any of the blogs. He does not know. We
yeah,
finally got him educated. He would know that he has to
right,
sleep because, we have crappy maternity policies here in the U.S. It's an important
right,
issue because, we're sleep deprived. We're sleep deprived new mothers, and then we go on and we have other kids, and we're just sleep deprived for years. So I'm joking about it because I lived through it. I'm still a physician, so I still don't sleep,
right.
but the baby part of it is over. But it's so frustrating to hear that, that is what we expect a good baby to look like. And that's the hardest part for me, is the sort of the inherent judgment in something that says, is he a good sleeper?
Right.
That's tough. You already are as hard as you can be on yourself as a new parent. You just really don't need people piling on. So
Yeah, exactly. And like you said, if in order for the baby to sleep, I mean that was my son. I needed to be around. So, and you know what? Honestly, it was a better thing. I needed to go to bed earlier. He was waking up a lot throughout the night, but because we were nursing, he was going back to sleep quick. But naps, I'm gonna tell you, until he was probably like 2.5, I really could not get up from naps without him waking up, and I just gave up. I just basically, you know, I had my little smartphone, so I would play on that, or I would, if I was really smart, I would sleep while he was sleeping, and that's what I would normally do. And I was so thankful that I was a stay-at-home mom because I wasn't getting all of the sleep throughout the night, so I could make up for it during the day.
sleep when the baby sleeps, eat when the baby eats, do laundry when the baby does laundry. Yeah.
That's a great one. I like that. Yeah, and I mean, along with the expectation of what your baby should do, there's the crying it out aspect of, it's okay to let your baby cry it out, because that, then they'll go to sleep. So, that's the 21st century expectation that I feel is really hurting our children and their attachment,
Yeah.
to their parents.
You can tell that there's so much more that we need to do to support new moms, because cry it out, I think it just comes from a desperate need to get sleep.
Yeah.
When you're working and you have a brand new baby. And so for us here in the US, it's almost untenable to think about how much of our new motherhood is spent sleep deprived. And I think that solutions like that come of a necessity from a chronically sleep deprived population.
Yeah.
So
And you said,
I'm not sure we would have a lot of people who would do that if they were actually getting some rest, like able to rest during the daytime when the babies are sleeping better. I'm not sure that we would hear so much about crying it out.
yeah,
But there is an expectation at some point that the kids are just magically going to feel safe in their environment and learn how to figure this out. And resetting those expectations for typical like baby and toddler behavior is part of what I do. And
yeah,
a lot of times it's not very welcome news, but we are putting pressure on an infant and a toddler that are like genetics, that we're just not ready for that yet.
yeah.
Like that's what it's not something we're adapted well for. So
I think that, maybe it's a little bit to do with our culture. We want the quick fix for everything.
yeah. It's painful though. Most of the
Yeah,
people that I deal with in my practice, and I'm very, my patients are fantastic. They, but the they have attempted cry it out and they're like, I just can't do it. And I think that that's a sign that if you're really struggling to do it, then it's just not for you.
Yeah, definitely. And that's where the mama instincts, hopefully, just parental instincts just come in, that that doesn't feel good. And so, let's not do that. Okay. So I think we're kind of heading over into baby behavior.
There you go. Yeah. There you go.
And I mean, one of those, my son saw a little kid the other day, and he was saying that the kid, was crying and that he was a crybaby. And I said, actually, that's a little baby. He's actually communicating right now. That's how he talks. He doesn't have words right now. So he's trying to communicate with his parents that way. And I think that it would be nice if we all just understood that it's not a bad thing when our kids cry. It's, if we're not around to console them, then that's my own preference. I want to be there. I want a baby in arms crying is okay, but that's the way that they're telling us what they need. So that's one of the things I was thinking of. That's just such a trap and such a misinformation about baby behavior that
it starts right from the beginning, right? So the baby's crying, we pick them up. The baby stops crying, we put them down. They start crying, and somebody says, "Uh-oh," they got used to being held. No, they didn't. Like, the biological norm is to be held.
Yeah.
So it's influences coming from other places that sort of dig against what maybe our instincts are telling us, but. Yeah. The milk in the first several days, breast milk in the first several days is mostly immune system components and things that are designed to help jumpstart the immune system. And so I have a really hard time with trying to explain what the baby, rooting and I've now started to call them, instead of feeding cues, survival cues. Like, because a lot of parents will notice that the babies are doing this, and you pick them up and they go right to sleep. And you go, well, wasn't that a feeding cue? And the baby's like, victory is mine. I got back to mom. Like, it's a survival cue. Like, pick me up.
Yeah.
Like, I'd like to be with you. Like, so mom.
That's why I love baby wearing. I baby wore, oh my gosh, it was my savior.
Was it? I never did it.
I wore my son most on the front forever. And then once that he could sit up, assist by himself, and I could put him on my back. And I mean, it's been such a it was a huge thing for us, big time, because he never wanted to be put down at all, ever. And so I was just like, okay, like, I think that is one of the things too, Dr. Jenny, that with sleep, with behavior, us parents, us adults, we have to just release the control. Like, we cannot control the sleep. Yeah. Can't control the behavior. I
think some of the most miserable people I've ever seen in my office, like full-blown, like, upset, are people who've tried to put their kids on a schedule because somebody said that their kids should be on a schedule, and every 2 to 3 hour feeding, and the babies just aren't complying. And the confusion is, well, somebody else's baby did that. Why isn't my baby doing this? And I need to have my baby on a schedule, right? Everybody says I should have my baby on a schedule. And I'm like, is it working?
Yeah.
No. I'm like, then I think you found your answer.
Yeah.
So it's the control part of it is probably, I think with the first baby especially, you sort of think, I can do this. I can do it. And as soon as you figure out, like, that really you can't, that it's probably better.
Yeah, exactly. And I mean, there's the aspect too of just being a new mother, and like, whoa, all the things that you have to decide. And then all of a sudden, these physicians that you're looking for their expertise, and they're asking you, and that's awesome, because you do need to decide, and it is your decision. This is your baby. And you are the voice for this baby. So, but gosh, every kid is different, and every kid, from what I hear, I haven't had, we only have one, but I hear from one child to the next in a family, you know, is different. So
crazy different, crazy different. Like,
yeah.
I thought I had this thing down, and now I introduced this new little creature, and they're nothing like the last one. So now what do I do? So, yeah,
Exactly.
everyone's an adventure.
Yeah. Well, I definitely feel like, you know, we a lot of subtopics here, but it's just that's one of the reasons why I do this show. It's so needed to support, because there's just so much misinformation out there, and if you're not educating yourself as a parent, or just as a person, you know, from, you know, everything from what you put in your body, then it's, you know, it can be really hard and overwhelming, and you can feel lonely in this, you know, in parenthood. So, you know, and with education, hopefully you find that support, like that tribe, that village.
You got to find your tribe. You just got to find your tribe. Absolutely. You got to find people that are positive and help you feel better about the decisions you make.
Yeah.
And got to find the right fit in terms of a pediatrician too. So
Yes.
that's important.
It is, and I didn't even know that we needed to interview pediatricians when we had my son 5 years ago, but we did, and it was great. It was nice to go there pregnant and kind of, you know, make your decision, and gosh, to do that before the baby was here, it was nice to kind of get that out of the way too. But I want to, before we end the show here, I want to talk a little bit about you, and your website here. I'm going to bring this up again, which you've had on your lower third there, but it's drjenforkids.com, and so please go
I
there.
started writing that in 1998. That was the Jurassic era of websites. So it's been around for a while. So be kind.
Yeah. Well, you know what? Honestly, the information, like I said, that is the sleep article that I've shared is still saved in my, you know, easy to just copy and paste over quick.
That's
So,
great.
yep,
That's
it works for me. The information works great there. But I also want to point out too, you're on Facebook under Dr. Jen for Kids, but you also have a Facebook page, Dr. Jen for Kids Breastfeeding Medicine, that you share a lot of awesome information on. I found that page today. But you also have a book that is available. It's called Dr. Jen's Guide to Breastfeeding, and you can find that on Amazon. So I wanted to let our audience know that. If you want to check it out, then check it out on Amazon. Again, it's Dr. Jen's Guide to Breastfeeding. And I'm sure, you know, there's tons of other articles besides just the one that I came across as far as the baby sleep. So do check out drjenforkids.com. And if you happen to live in Wisconsin, and I don't know if you're still taking new patients, but
if you're in the Milwaukee area, stop by.
there you go. If you want an absolutely amazing pediatrician who supports breastfeeding, woo! All right, we're all going to move to Wisconsin. So, all right, Dr.
Nice
Jen.
to be here. Good football season, beautiful weather.
Yeah, there you go. The seasons. You guys actually get the seasons.
Yeah, we have seasons here. Yeah, that's what they're called. We have 4 of them, sometimes all in 1 week.
Oh,
So.
yeah, very cool. Right on. Well, thank you again so much. I really appreciate your time tonight. And I will throw a few of the things that we talked about under the comments on the show. And let's see, my show, not this coming week, but the week after, we're going to be talking about with Susie Walton from The Joy of Parenting. And I've had her on a few times, but we're going to talk about with children and parenting, telling them what to do and not what you want them not to do. So that should be a really fun, powerful episode. Those are one of those episodes that I just need to kind of keep on watching over and over again. You just need that support. So, well, thank you, Dr.
Yeah, you're
Jen.
welcome. Thank you
Yeah.
for inviting me.
Oh, no problem. I'm glad we got to get together and have this time. So I'm going
Yeah.
to stop the broadcast here. And thank you guys very much for watching. Again, if you didn't watch live and you're watching this later and you have any comments or questions, just leave them below the YouTube video here. Thank you guys. We'll see you next week. Bye-bye.